Sulfonamides, also known as sulfa drugs. They fight against bacteria and can be used in a combination with other drugs. The action, they're primarily bacteriostatic, means slow growing, because of their ability to inhibit the activity of folic acid in bacterial cell metabolism. Once the rate of the bacteria multiplication is slowed, the body's own defense mechanism, known as white blood cells, are able to rid the body of invading microorganisms and control the infection. They are well absorbed by the GI system and excreted by the kidneys. They are used to control infections caused by gram-positive and gram-negative bacteria, such as E. coli, Staphylococcus aureus, and Klebsiella, and Enterobacter species. Sulfonamides can be used to treat UTIs, middle ear infections, ulcerative colitis. There are topical forms. Sulfamylin and silvadene prevent infections in second and third degree burns. There are mild to severe reactions when on sulfonamides. Mild reactions consist of loss of appetite, nausea, vomiting, diarrhea, abdominal pain, inflammation of the mouth, chills, fever, and photosensitivity. Serious adverse reactions consist of hives, itching, TENS, and Stevens-Johnson syndrome. Most frequent reactions seen with a topical application is burning sensation or pain when applied to the skin. Prolonged sulfa therapy can include a decrease in white blood cell count, decrease in platelet count, and deficient red blood cell production in the bone marrow. Any serious adverse reaction needs to be immediately notified to your provider and discontinuing of the next dose of medication. Sulfonamides are contraindicated to anyone with a hypersensitivity to sulfonamides during lactation and in children younger than 2 years of age. They are not given near the end of pregnancy, making them a category D. They're not used for infections caused by group A streptococci. Used with caution with anyone with renal impairment, hepatic impairment, or bronchial asthma. Interactions can be seen when sulfonamides are administered with oral anticoagulants, methotrexate, or high antoids. For optimal response to the drug therapy of sulfonamides, take the drug at the prescribed time intervals. These time intervals are important because a certain amount of the drug must be in the body at all times for the infection to be controlled. Drink 6 to 8 ounces of fluid while taking these drugs and take each dose with a full glass of water. Do not increase or omit the dose unless advised to do so by the primary healthcare provider. Complete the entire course of treatment. Do not stop the drug except on the advice of the primary healthcare provider before the course of treatment is completed, even if symptoms improve or disappear. Failure to complete the prescribed course of treatment may result in a return of the infection. Follow the directions supplied with the prescription regarding taking the drugs with meals or on an empty stomach. Take the drug on an empty stomach 1 hour before or 2 hours after a meal. Distinguish between immediate and extended release medications. Do not break, chew, or crush extended release medications. Notify the primary health care provider if the symptoms of the infection become worse or if the original symptoms do not improve after 5 to 7 days of the drug therapy. Any exposure to sunlight or ultraviolet lights while taking these drugs and for several weeks after completing the course of therapy, wear sunblock, sunglasses, and protective clothing when exposed to sunlight. Avoid tasks requiring mental alertness unless response to the drug is unknown. Common drugs that are used within the sulfonamide class are sulfadiazine, sulfasalazine, also known as azufidine, trimethoprim and sulfamethoxyl, also known as Bactrim and Cepra. Topical forms known as sulfamylin and silvadene used to treat second and third degree burns.